Okay, let's just get right into it because today we are looking at a terrifying but honestly incredibly important scenario. Just picture this: a toddler playing in the kitchen silently swallows a single gulp of an industrial drain opener that was left open under the sink. Or maybe a distressed teenager drinks household bleach in a moment of crisis. Literally within seconds, a hidden fire is lit inside their chest. So this explainer is going to walk you through exactly what to do in the very first 60 minutes if anyone, a child or an adult, swallows a household chemical. Because look, what happens in that crucial first hour at home, that's going to determine whether that patient walks out of the hospital totally fine or faces a lifetime of surgeries. Now, I want you to test your own instincts for a second. If this happened right in front of you, what's your gut reaction? What is your very first move? Do you force them to throw up to get the poison out? Do you grab a glass of milk or maybe some lemon juice to kind of cancel out the chemical? Well, as we're going to learn from the medical protocols today, the most common human reactions to this specific emergency, they're actually often more fatal than the chemical itself. Crazy, right? So to give you a highly focused, life-saving guide, we've structured this explainer into 5 critical phases. First, the first 60 minutes. Then, how chemicals destroy tissue. Third, the absolute forbidden actions. 4, a step-by-step emergency guide. And finally, prevention and medical care. Let's do it. All right, starting right off with Phase 1, the first 60 minutes and the real stakes of corrosive intake.
Here's the thing. Every single second counts when someone suffers an internal chemical burn from strong household cleaners, whether that's an acid or an alkali. I want you to think of the lining of your mouth, your throat, your esophagus, basically your food pipe, as being as fragile as a delicate silk scarf. Now, if you spilled a harsh chemical onto a silk scarf, you wouldn't vigorously scrub it, right? And you certainly wouldn't pour another harsh chemical on top to try and somehow fix the spill. That would literally shred the silk instantly. Instead, you'd immediately stop the exposure and handle it with extreme gentleness. Well, your internal organs, they require that exact same level of delicate care.
Moving on to Phase 2, how chemicals destroy tissue, or really a look inside the burning process.
So the wild part here is that the burning doesn't just magically stop on its own. Household chemicals generally fall into 2 categories, and they destroy tissue in 2 completely different ways. Acidic agents, things like toilet bowl cleaners, they cause something called coagulative necrosis. Basically, they sear the surface instantly, forming this dry, charred crust that actually blocks the chemical from going any deeper, though obviously it still severely damages the stomach. But alkaline agents, like liquid drain openers or oven cleaners, man, they are a completely different beast. They cause liquefactive necrosis. They literally melt tissue fats into a liquid soap. That means they don't stop burning at the surface. They just keep melting downward, deeper and deeper through the layers of the food pipe.
And because of the way these alkaline agents melt tissue, we run into this frankly terrifying biological trick called the soap maker's trap. You see, a lot of drain openers contain lye, and as lye destroys your tissue, it actually kills the nerve endings right along with it. Because those nerves are dead, an incredibly severe alkali burn can initially feel way less painful than an acid burn. So listen to me carefully here. You must never, ever judge the severity of the swallow by the victim's pain level in that first hour. I mean, they could literally be smiling and talking to you while their esophagus is actively dissolving. So, if you can't rely on pain, what do? You need to watch for these critical red flags. If you hear a muffled or hoarse voice, or maybe a high-pitched squeaking sound when they breathe, that's called stridor. Or if there's an inability to swallow paired with just continuous drooling, or their stomach gets rigid and board-like. If you see any of that, the chemical has already compromised the airway or burned a hole straight through an organ. This is a Category 1 life-threatening emergency, guys. Literally, every second matters here.
Okay, Phase 3, the absolute forbidden actions. These are the deadly instincts we all really need to unlearn.
Now, before we actually list these out, I want you to know that to make sure we're dealing with absolute ironclad facts here, the banned actions we're about to cover are strictly derived from the World Society of Emergency Surgery and World Health Organization guidelines. So this isn't some internet folklore, you know? This is the absolute highest level of emergency medical science. All right, here is the banned list. Print this out, take a mental screenshot, and just memorize it. Doing any of these 4 things will turn a highly treatable injury into an absolute fatal disaster. Number 1. Never induce vomiting. Number 2, never give neutralizing agents. 3, never feed the patient. And 4, never delay hospital care. And I mean never, even if they claim they feel perfectly fine. So why are these so incredibly dangerous? Well, think back to our silk scarf analogy. If you force a patient to vomit, their throat muscles contract violently, squeezing tissue that is already melting and paper thin. This violently tears the esophagus a second time. That can rupture the food pipe and spill chemicals and bacteria directly into the chest cavity right next to the heart. And just to put that into perspective, that specific complication is fatal in up to 80% of cases. 80%. And what if you try to give a neutralizing agent, like, say, vinegar or lemon juice for an alkali burn? Well, that causes an intense exothermic chemical reaction. It generates so much extreme heat that it literally cooks the internal organs from the inside out. Just no.
Which brings us to Phase 4, the step-by-step emergency guide. Exactly what to do right now.
Obviously, the very first thing is calling emergency services. But as soon as they're on the line, you need to execute this sequence perfectly. Step 1, in the first 2 minutes, immediately take the container away, check their breathing, and have them spit out any remaining chemical or residue in their mouth. But whatever you do, do not stick your fingers down their throat. Okay, step 2, minutes 2 to 5. Gently flush any splashed skin, lips, or eyes with a steady stream of lukewarm water for a full 15 to 20 minutes to decontaminate the surface. And then step 3, minutes 5 to 10, prepare for the dilution decision.
Now, I gotta stress this. This next step requires extreme caution. You may give a few small sips of plain water or milk. We're talking absolutely no more than 100 to 200 milliliters here, just to rinse the mouth and slightly dilute the chemical. But, and this is a huge but, you may only do this if the patient is fully conscious, alert, and swallowing normally. You must stop instantly if they cough, gag, drool, complain of pain, or show even a hint of lethargy. Make sense?
All right, so once the paramedics arrive and take over, your job is to secure the exact chemical bottle as evidence. The active ingredients on that label are going to dictate the doctor's entire strategy. Once you get to the ER in that first hour, doctors will secure the airway. But notice this, they will absolutely avoid using blind stomach pumps. They have to protect that weakened, melting tissue from being poked through. Instead, a little later, usually between hours 12 and 24, they'll opt for a tiny flexible camera called an endoscope.
And that tiny camera is a real game changer. It allows specialists to look directly at the lining of the food pipe and actually grade the internal burns on a scale of 1 to 3. So a grade 1 is just some mild redness, but a grade 3, that represents severe tissue death. And that single number is absolutely crucial because it dictates the exact recovery timeline and all the surgical needs for the patient moving forward.
And finally, let's wrap up with Phase 5, prevention and medical care. Basically, how to secure your home.
Right here is your ultimate quick survival reference table. I highly recommend taking a mental snapshot of these rules right now, because knowing the difference between a safe rinse and a fatal attempt to induce vomiting is quite literally everything. Spitting out excess chemical? Yes, do it, it stops contact. Rinsing the mouth with plain water? Yes, that safely cleans surface toxins. Forcing vomit? Absolutely 100% no, it causes explosive internal tears. Drinking vinegar or lemon juice? Again, no, the heat reaction will cook the organs. Got it?
But you kind of have to wonder, how do these accidents even happen in the first place? Well, this statistic is just heartbreaking. More than 70% of pediatric corrosive ingestions happen simply because well-meaning adults transfer toxic cleaning chemicals into familiar, non-toxic containers. We're talking old plastic juice bottles, soft drink bottles, or even just water cups.
Look, a child cannot read a chemical label. They just see a familiar juice bottle and they naturally assume it's perfectly safe to drink. So you absolutely must adhere to the safe storage mandate. Always, and I mean always, keep chemicals in their original, factory-sealed, child-proof containers. And store them on high shelves, far out of reach. Definitely not down low under the sink where a toddler can easily crawl to them.
As we wrap up this explainer, I want to leave you with one final, pretty urgent thought. What toxic chemicals are hiding in familiar bottles or just sitting unlatched under your kitchen sink right this very second? Seriously, I highly encourage you to go check those cabinets the moment this finishes, because applying this safe storage knowledge today, it could very well be exactly what saves a life tomorrow.